So this is a fantastic topic, and I don't know how many years we've had a share at this time. Journey is consistent. She always makes sharing happen, and she always gives me the honor of inviting me to speak, and I always appreciate the opportunity. And when she actually sent me the topic, it said physical and mental health. So that's what I put it around, and then I realized, then I saw actually Hanula speaking on physical. It doesn't matter, it doesn't really change my topic, because actually the two, as Hanula showed, and all the statistics she gave, go very well together. But I thought I would talk a little bit about the kind of lives we're living, and to tell you that how we got here. It's really, really fascinating. So when I studied occupational therapy in the 1970s, before there were computers, what we did was we actually used a lot of physical activity. And whereas physios would get people to strengthen, let's say, biceps by doing this 10 times, we would develop activities using different crafts and mechanisms and pulleys and ropes. It was really fascinating, actually, when I think about now what we actually did. And a big part of what we did was sport and exercise. So when I did one of my placements in a place called Tara, which was I don't know what you'd call them now, mental health facility, the physios or the other doctor, the psychologist, would see you maybe an hour a day, and the rest of the day, the 7 hours, they were actually with the occupational therapists. And we had, as I say, sport, we had recreation, we had houses that were called activities of daily living, where we help people get back to cook. But they were busy. If you want to, we kept them active, and we'd actually plan. It was a medical degree. It's not like a diversional therapist today. We actually planned treatment programs where exercise and sport was absolutely integral. And I think back now, and I wish I had photographs, because I was doing this thing that we actually learned how to throw javelin, discus. We did all these crazy sports where we developed muscles. Throwing discus, quite a job actually. But there I was, throwing the javelin and showing other people how to do it. But being active was a huge part of recovery, and getting people out of bed. So when people were depressed, we would go and we had to develop persuasive skills to drag people out of bed so that they would get moving, because it was understood that lying in bed all day when you were clinically depressed was not good. So in those days, there weren't many antidepressants, and there were, and that's why there were also lock-up facilities. There was much more psychosis, but it was in the time where it was being developed. And in around 1982 was when Prozac came out. And it was this miracle drug, and Prozac and other medications changed the face of mental health. You don't have those kind of facilities anymore. People can have antipsychotics and they can live in the community. But literally in those days, one of my placements was at a place called Sterkfontein. On many South Africans here, so keep looking at Charlie, she might know, where we would go and there were lock-up wards because people were so psychotic. You don't have that anymore. So it was a big thing in 1982. People started taking antidepressants. And the move became away from movement and activities as a form of treatment. Sorry, Miriam, do you have a tissue for me? Sure. I'm sorry. And to actually, the main thing became medication. Okay, I'll just use it. Became medication. And of course, psychotherapy was building up very, very strongly. And the way also that most people worked used to be more analytically. So analysis would require quite a few hours a week, and it was all about sitting. Actually, the classic analyst, you were literally lying on a couch, no movement, no eye contact even with your therapist, and it was all about deep insights. And please, I'm not criticizing any of this, I'm just giving it historically. Around the late 80s, because there was sort of this period where there was this great excitement about the medication and analysis, certain people started doing research, and that's when cognitive behavioral therapy started, where the behavior was thinking you've actually got to get people moving as well. But literally since the 80s, as medication have got better and better, the move away from using exercise and other treatments, we did also other very interesting treatments, became mainly medication. And then, well, certainly in Australia since the 2000s, since Medicare came in, psychotherapy, different forms of psychological treatment. Now, if you look at the statistics, anxiety and depression is not decreasing, it's actually increasing. And, you know, researchers are looking at why is it actually not getting better. We live in a very sedentary world, so even our occupations have changed. Because so many people work in IT, whatever that means, on computers, and now even worse, people are working and living at home. More and more people are sedentary. So there's a fantastic book that I'm going to base a lot of what I'm saying by Bessel van der Kolk. It's called The Body Keeps the Score. And when I read it, and he's probably my age, he describes exactly that. We both lived through the same epoch, if you like. He was in America. He was a psychiatrist, I think, at Harvard. And until Prozac came in, the psychiatrists were literally in the basement because it wasn't seen as much of a science or a medical thing, because it was mainly analysis, and they weren't able to treat the very sick people. And then once Prozac and other medications came in and they could measure progress, literally, he says, they moved from the basement, they got proper windows and proper offices, and psychiatry gained recognition. But what was lost was this idea that we're not just words and we're not just our head, we're a whole person. And you need your whole body to function well. And so his book, The Body Keeps the Score, one of the main things he talks about is that not everybody deals with things in the same way, and talking therapy isn't for everybody. So some of the trauma research that he talks about a couple in Canada, this is one example, who were involved in this huge pile-up in the 1980s. I think it was a 70-pile car pile-up where lots of people died, and both of them were traumatized by this. By then they had developed some kind of technology, maybe the beginnings of MRIs, and they were able to compare the brains. And what they found was, so first of all, they also saw that the husband, he was quite happy to go for talking therapy, but his wife was totally silent. She couldn't talk about it. And when they x-rayed the brains, they found that her speech area, I can't describe what it was, but was sort of shut down. They were able to see it was shut down. So people have events and traumas, and some people are able to go and benefit from talking therapy, but other people aren't. They're actually shut down. So he became very interested in this, that talking therapy is not for everybody, medication's not for everybody, and as I say, the medication isn't really changing lives. It often helps moods, but it actually, people are getting more depressed and feeling worse, more trauma, more suicide. It's really not a good situation. So he then has done a lot of research into the things we used to do, like sport and exercise, and showing that for many people, that is the way to go, that they need to deal with their trauma or their depression in other ways, not just to rely. If it works for you, fantastic. But if it doesn't, try something else. So he talks about things, and he has a website, and he invites anybody that does anything. If you feel that you have a treatment method that doctors don't know about, and he will research it. So he has researched yoga, he has researched hypnosis, he has researched neurofeedback, psychodrama, massage. All these things he's actually done formal research and shown how people benefit if they've suffered from trauma or depression from doing those therapies. And he doesn't use the words alternate therapies, they're enhancing therapies. So your body is very important for your mental health, and it's so obvious because we're a whole person, but if you think about the way we've gone about mental health, I'm talking about my profession, it's literally from the head up. You can just go in and talk, you can be cognitive, you can intellectualize, and there's no discussion of actually your life or what's going on in terms of movement and so on. So I have to say that maybe because of my OT background, but when I started developing, I have an anxiety treatment program. I built it into a manual, and it's a manual that you need to go through systematically. And the idea is that people become accountable. So a lot of CBT therapists, if any of you have had it, and again, none of this is a criticism, you'll go and one day they'll do a bit of this, and the next day next time they'll do a bit of that. I've done it in a very consistent way in order that people build it into their lives, various things into their lives. One of them is the 4-step process that I teach for anxiety management. But in the very, very first session, I get people to commit to exercise. And I say exactly what Hanela says, even if it's 10 minutes, find a time, write it in as a commitment, and when they come in for the second session, because it's in a manual that they bring in, we go back and we check. They have a monitoring diary whether they did the exercise or not. And it's often a start of being accountable. And if they haven't done their exercise, they're not in trouble. We say this is not school. But we look at why. What are your motivations? What's holding you back? Sometimes it's just a delay to get going. So I know some people by the third session, after they've come twice and shown me that they haven't done anything, maybe it's a bit of guilt, but often there are underlying reasons. So if you can't find your why, sometimes it's worth going to a psychologist or someone who can help you understand what's blocking you. So we do have blocks to do. There are blocks for people who don't want to go for psychotherapy, and there are blocks for people who don't want to actually do exercise. And they're fascinating reasons. So one of the things that you didn't mention, and I don't know if it's become a non-politically correct word, but a lot of people want to exercise to lose weight. And but often people hold on to their weight for all kinds of psychological reasons. Here they want to lose weight and be thin, but internally, for all kinds of reasons, they want to stay this way. So that's why you'll often see people lose weight and then they put it back on again. Because they're self-sabotaging. So often there's a psychological reason that we don't do what's good for us. And sometimes you do need to do a bit of work if it's not coming easily. Why am I not doing it? I know it's good for me, and yet I'm not doing it. So one of the things that the Rambam says is, he says, if a person owns a horse, he knows that the horse needs to go for a walk twice a day, and that the horse eats hay and not licorice. But we don't treat ourselves like that. We don't make sure we have our regular walks, and we eat licorice and not hay, whatever's good for us. And this is a very interesting thing, and Jordan Peterson also writes about it. We live in a world where people do more for their pets than for them. So again, I'll often have people that I'll say, do you exercise? And they'll go, no, but I walk my dog twice a day. I said, well, you are exercising. Well, if I didn't have a dog, I wouldn't. But the dog's got to go, so I make sure, literally, they don't. So sometimes why? Why do you prioritize? Love your pet by all means, but it's a fascinating thing that often people will look after their animals but not prioritize themselves. So sometimes it's a self-esteem issue. There are all kinds of reasons that we self-sabotage. And that's where the work needs to be done. Then there's also the idea about forming a habit. So when you start something consistently and you form a habit, it gets easier and easier. So in the beginning it's quite difficult, but after a while it gets very easy. So this has become a very popular topic. There are books called, one now here I've called Atomic Habits, but it's become also a very fashionable word. But the Jewish way of life is full of habits. If you think about our lifestyle, it's very organized and habitual. We have to do things by a certain time. If you're a man, you have to get up and go to shul at a certain time, or you should. A lot of it are built-in habits. So when you start building in a habit, that can help you. So very often, someone here used the word, I think, willpower or strength. When we come to weight loss or exercise, that's a very hard word to use because it sounds difficult, and it's like, so the idea is, how do I build in a very easy habit? It's not hard work, as Kadala says, 10 minutes, something easy, and if I just keep doing it, it'll become a habit. And literally how habits work in the brain is you form a neural pathway, and it gets thicker and thicker every time you do it. So see it as a habit that you're forming, a good habit, and you can link it to something like the shoes next to your bed. You can link it to brushing your teeth, If you link it to something you're already in a habit, like when I say to people when they do my manual, I say, do you eat dinner at a regular time? And if they do, put the manual on your table, and this, before you start your dinner, you're going to do that every night. You get into the habit of doing that. So link it to another habit. So it's a very interesting thing, as I say, that we live in a world where also people want things to be easy. And that's one of the downsides about medication, that it's much easier to go to a doctor and say, I'm feeling down, not on my clinical depression, and he gives you a pill, and now you can get 2 months at a time. You don't have to even go to the care. Just pop a pill every day. Doing exercise or looking after your body, watching what you eat, is hard work. So people have taken the easy way, and it feels like it's hard, but again, once it becomes a habit, it's not hard. But again, the Jewish way is, what do they say, the bread of when you give somebody, a poor man, bread, there's a feeling of shame. We're meant to work for things, and when you work for them, the pleasure that you get is greater than any other pleasure. Then getting something is less pleasure than when you learn how to swim or when you have what we call self-mastery. So the rewards are huge. Self-mastery builds your self-esteem. So that's a huge reward. So it helps with your trauma, it helps with your mood. We know that if you have mild to moderate depression, exercising every day is as effective as taking an antidepressant. So this reminds me always of people who have certain types of diabetes. They go, I can never remember if it's type 1 or type 2, I think it's type 2. And the doctor says to them, and doctors are not really good at this, if you just change your diet and you exercise, you won't need medication. And the majority of people say, just give me medication. Rather take whatever it is, Diabex or whatever those medications are, because it's easier to pop that pill than to change my life. But we all know that living in a particular way, the benefits are huge. Whatever you bring into your life in a healthy way, it's very hard actually to measure what it is. So I'm going to talk to you a little bit about something that hopefully will get you going and give you a way of looking at it. So Stephen Covey, he was very famous for writing a book, The 7 Habits of Highly Effective People. And it's a classic. He was a very famous, he became famous from his work. He worked in the corporate world as a motivational speaker. He was very interesting because he was a Mormon and he had a very large family. And he always prioritized his family. And he was known that he could talk at a corporate function of 15,000 people. And then at the end, he'd show a slide of himself and all his children and grandchildren and talk about family values and how important they were. So in the days of the 80s, again, pre-computers and pre-Excel spreadsheets, we used to have planners. And they were quite cumbersome. You'd have a planner that had days, remember, and then your week, and then your month, and then your year. So you could sit down in January if you were organized, and you'd have your year planner open, and you'd put the birthdays in, and you'd put the Yom Tovim in, and you'd put your holidays in, right? And then you would transfer it to the September, or you transfer it. So it's on the year. It was a lot of work, right? For people who were organized, but you had all these planners. The other thing that became very fashionable then were lists. And I can't remember what they called it, but people would go into organizations and teach time planning. And what they would do is say, make a list of what needs to be done, put it on what's most important, you'd schedule it, 1, 2, 3, 4, 5. What wasn't done today would go into list B, and then Tuesday you look at list B and Tuesday's list, and then you reprioritize, and then you're carrying it over. And people would do B list, but he was teaching people of how to prioritize what needs to be done. So he actually said, this is all wrong. Because what people are doing is they just have a schedule and they're prioritizing it. What you need to do is not prioritize your schedule. You need to schedule your priorities. So he has a famous story that he tells called Sharpening the Saw. And the story goes, there was a wood chopper with a blunt saw. and the wood chopper is huffing and puffing and trying to saw down a tree. And someone walks past and says, "Excuse me, I don't know if you're aware, but the saw is blunt." And the wood chopper gets offended. He says, "You think I'm an idiot? I can see it's blunt. I don't have time to sharpen the saw. Can't you see? I've got a whole forest I have to chop down." So he says that the foolishness of the wood chopper is if he just took half an hour to sharpen the saw, he would get through the forest much more quickly. So he says that's how we need to look at looking after our body and looking after our food and looking after our relationships. We're not being extravagant. We're not being selfish. We're not being lazy. We are sharpening the saw so that we are better individuals, mothers, sisters, daughters, friends, workers, whatever we need to do. If we take that time out to sharpen the saw, everything else will follow. When we think, "I don't have time because I'm so busy, look what I've got to get through today," we are like that wood chopper hacking away with a blunt saw. So whenever I have, people who tell me I don't have any time, I've had mothers of young children tell me they don't have time to eat. I've had CEOs tell me they don't have time for their families. Because they're so busy, they're not taking time to sharpen the saw. So very important, know that it's very important you look after yourself. And instead of making a list and going 1, 2, 3, you sit down with your priorities, you schedule them first, and then you put everything else around it. So he has 5 domains to sharpen your saw. And the first one is physical. And I do this with people, and you'd think, that some of these things are obvious, but they're not. We literally sit down and go, do you eat regularly during the day? And a lot of people don't. And then their blood sugars drop, and then they eat the wrong food, or then they think they're having a panic attack, but really they've just got low blood sugar. All these things. Or, so you sit down and they put that in first. What time, or certainly one meal a day has got to be consistent, but often people actually literally have to plan to make time to shop that's a priority, you've got to eat. And then sleeping. Do you have a routine for sleeping? And we know with sleep hygiene, if you go to bed around the same time and you wake up around the same time, you will feel much, much healthier than if you don't have a routine. Because what happens, talking about neurotransmitters, is when you go to sleep at the same time every night and you have a bit of a ritual, right? So you put your phone outside the door, you put on your pajamas, you climb into bed, you read a book, all your sleeping neurotransmitters start working. She's getting ready for bed, and you'll fall asleep easily. And then when you wake up consistently at 7 a.m., at about 6:45, your wake-up transmitters go, wake up time, and you will be alert even if you go to bed late that night, because that's the time your alert ones come on. But if one night you're going to sleep at 12 and you wake up at 12 the next day, and your neurotransmitters literally do not know when to switch on and when to switch off, and that affects your mood. We know today that a lot of depression and anxiety comes from these irregular habits, and a lot of them are made worse by people sitting on their phones or taking their phones with them to bed and not being able to switch them off. So routines are incredibly important for mental health. They don't have to be rigid, but they've got to be enough that your body knows what to do, when to wake up and when to go to sleep. So the Black Dog Institute, which is a world expert in treating depression, they've sort of expanded now, they actually have a daily monitoring diary where you fill in your meal times and you fill in your sleep times. So that's physical, and then exercise is the other physical thing. You slot in when you're going to exercise. So if you think about, before you thought about work or your children or anything, you're making sure you're eating, sleeping, and exercising. Then you can think about your next priority. So your next priority could be something like getting your emotional needs met. So if you're in a relationship or you're married, you make sure you've got a date night with your husband. If you're not, you make sure that you see a good friend, that you've got someone that you can talk to in a deeper way, or that if you've got a therapist, that you see your therapist, that you've made time for. Anything that builds your emotional well-being in an intimate relationship, you lock that in. Then social is the third one, and that's more the fun things. And I found that people, well, certainly I know that for me, social is one that I actually have to prioritize. It's so easy for me not to have time to see my friends. Might see them on Shabbos, but busy working, busy doing things, and you become depleted. You have a bit of fun with a friend, your mood immediately lifts. Laughter is medicine. Laughter is incredibly healthy. So you build this in, that social is also an important thing. See, I haven't come to work yet. Spiritual is another one. Whatever, helps you feel connected to your soul, that feeds your soul. So for some people it's davening and going to shul. For some people it's listening to music. For some people people tell me it's yoga or meditation. Doesn't matter, but it's this feeling of, or sitting in nature, that it's hard to explain in words, but when your soul feels nourished. And then the fifth one is mental stimulation. Now, mental stimulation is something that has nothing to do with your work. So if you are a mathematician, your mental stimulation might be something like reading literature. Doesn't matter what it is, playing chess, doing something else, but you need to work different parts of your brain. So just like when you exercise, you get a full body workout. You don't just exercise one part of your body. You also want to exercise different parts of your brain. So when you've blocked that all in, and there are worksheets and you can Google them, there are lots of different designers who've used it. It's very famous. There are also lots of videos of Stephen Covey or people telling us about making sure that you are scheduling your priorities. Then when that's in place, then you can think about fitting your work around it. So it's not about, let me see if I can fit in exercise and I've missed it. It's exercise is locked in, and I have to live my life around my priorities because I need to keep the saw sharpened. Very, very important. I want to just talk about laughter as well. So, because this is also a fascinating story. Sorry. Sure. So there's a man, his name is Norman Cousins. I don't know if any of you have heard about him. His daughter's actually from, and her name is Sarah. She wrote a book, Growing with My Children. I don't know if any of you know that book. She's written a few books. Sarah, I can't think what her surname is now, maybe Shapiro or something. But she actually writes about that he was her father, and she became from. He wasn't from, but he's a Jewish man. And in the 1960s, he was diagnosed with ankylosing spondylosis. Now, in those days, it was an unbelievably terrible disease with absolutely no treatment. It's an inflammatory condition where basically everything stiffens up until eventually you can't move and you actually can't breathe because your chest doesn't work. It's a terrible, terrible illness. They have now different anti-inflammation medications, but in those days it was a death sentence and a horrible, cruel death. He was a writer and a journalist, and he booked himself into a motel and he watched comedies. He happened to like slapstick. He liked Charlie Chaplin and the Three Stooges, who used to beat each other up, you remember them? And he used to have a belly laugh. And then he would write for how long he was pain-free. And he found that over the 2 weeks, the more he laughed, the longer the periods that he was pain-free. And so he wrote it up as a journal article. And there is a form of research, Piaget used it as well, where instead of having a big group and using statistics, you can have one case in great depth. In fact, Freud also did that. And he wrote it up and he sent it to a legitimate journal. I can never remember if it's Science or Nature, but it's a very big journal in America, and it was accepted. They published it, and in fact, it still exists, you can Google it. They started an institute at UCLA on laughter, and he was made, I don't know if they called him an associate professor or something, where laughter was seen as a legitimate medicine. And I don't know why more people don't know about it. And maybe it also got lost in all the psychotropics from the 1980s. But you can Google him. He's written books. His first book was very famous about the laughter. So one of the things that I always tell my patients is find 2 minutes every day to watch something. It's so easy, it's so accessible now. Whoever you find funny, and have a laugh. But a belly laugh, not a little smile. You know when you watch something and you just like crack up. The other day I was watching something and I had one of those moments and I thought it's just such a good feeling, when you just something really cracks you up. So who makes you laugh. Again, it's nothing. It doesn't mean you're selfish. It doesn't mean you don't care about what's going on in Israel. You are sharpening your saw. So that is really, really important. And don't forget that you are a whole person. The other thing that I'm very interested in is, and again, there's quite a lot of literature on it and it's not promoted, is the fact that we need to eat better. Not only how we eat. So there's an institute in Melbourne, about mood and food. Quite a lot of research coming out. But there's also a book called Brain Mood, where even the food we eat is depleted in certain ways. So this particular woman, she's from New Zealand. She's written this book with someone in Canada. They have developed micronutrients. And these micronutrients, again, have been shown to help. They feed the brain, and then one of the side effects, they don't guarantee, but it helps with things like ADHD and memory and stress and so on. So it's not like just something you buy over the counter. Because they're micronutrients, they're very absorbable. So there are lots of different options that can help with your mental health. And so it's really good to explore what is going to work for you and what you need to supplement in your life. If I can just give a little commercial. So I've actually brought certain of these things into my practice. I was going to bring micronutrients, but this particular one that is so well researched isn't under the TGA in Australia. So it's in New Zealand, it's in America, but I'm not going to bring in something that's not under the TGA. Hopefully it will be. But we're bringing in neurofeedback, which is very well proven. You learn to regulate your brain waves. As I say, Bessel van der Kolk has researched it and validated it, but there's 20 years of research on it. And the idea is that the after effect, they do research 2-3 years later, and the benefits are still there. Whereas something like medication, often as soon as you stop it, the benefits go. So look around your brain waves, your body, your exercise, your food. There's so many things that you need to do for your mental health and so many options. And get to know yourself and what works for you. And of course go for therapy and of course find someone supportive to work with. But your mental health is much bigger. And the truth is, as you know, that when your mood is good and when you are mentally resilient, you can cope with everything so much better. When your body is well and resilient, the two together, you're a powerhouse. But if your body's depleted, it's very hard to have a good mood or to cope, and vice versa. You are a whole person, and you want to support both parts of you. Your head, actually all three, your mind, your body, and your soul. So I encourage you all to open up to all different possibilities that are obviously they should all be evidence-based. Find what works for you. But exercising, we started with that, works for everybody. But you've got to find the one that you enjoy, and that's the one thing. Not everybody enjoys everything. And in my experience, at different times, I've enjoyed different things. So when Shana was about 15, I used to drag her to gym. There was a gym in Rose Bay. I don't know if any of you knew that guy. He was like a dictator, right? He used to scream. But I felt I needed someone like that. And we would go at 5:30 in the morning, because I was working and Shana was at school. When I think about it, 5:30 in the morning, we would run up, and I'm not a runner, up New South Head Road. But I was so adamant that she and I would get fit. And I had the motivation to do it, and that was when we did it. And then it was okay, until he got so bad I left. But it was the beginning. I needed someone like that to yell at me. If we weren't there at 5:30, we got into such trouble, Shane and I. And I would tell her, if you don't get up, I'm in trouble. So you've got to behave. We've got to go together. But that was a time of what I needed, and now I do something different. But it's really important to find what you like and to be flexible. As I say, what works now might not work later. Try new things. Enjoy it. See it as a benefit. See it as overall helping you. And know that it's essential as food and sleep. So I'll end there, but I am happy to take questions.
So first of all, I want to thank